This is my client Gil, who came from Illinois for treatment, and over the past 20 years he's tried multiple things for treatment, seen all kinds of practitioners, and I'm going to have him describe how he feels in his body and describe the inciting event when he was in Marine Corps training. So can you tell us about the injury?
Yeah, the injury was...
and how you feel also.
We were a sit and stand drill where you stood in formation and you dropped and stood back up and dropped and stood back up until every head was down at the same time, and I happened to land on another guy's heel of his boot.
So you were falling onto your butt.
Dropping.
From standing position.
Correct. Dropping and falling, free fall to the floor,
yes.
And then back up. And the formation would get kind of turned and all over the place, and I happened to have landed on a guy's heel of his boot on my cossack bone. The pain was pretty excruciating. I was discharged. In the last 20 some odd years, I've been in pain through my whole body. I've tried chiropractors, holistic doctors, MDs, and here I am.
And so, and you feel like your whole body is rigid?
My body is stiff and rigid, correct. I've had 2 toe fusions because the cartilage of my big toes were destroyed. I'm in pain right now, can't find relief, and that's why I'm here.
Very good. So we'll start with your feet and ankles, and of course the toes are fused, the big toe is fused, so there's no motion there.
You see that? They're identical. Incisions right here.
Yeah.
So from here to here, this has been fused. Back and back, there's a little bit of bend back here, but pretty much it's fused.
Yes.
Both sides.
Very good. And go ahead and take your other sock off. And then lie on your back. And I'm measuring dorsiflexion, and you come up to neutral only, so the ankle's dorsiflex to neutral, and testing rear foot mobility. You're very rigid in the rear foot, and that's on both sides. I can't get any transverse plane rotation in the subtalar joint, just the slightest amount of movement, and I believe that that's treatable. We'll know when we start treating you. I can't evert the heel, okay? And now I'm going to demonstrate hip motion. I'm rotating the hips medially, and you only go in perhaps 5 degrees, maybe 10. And that's the same thing on this side. When it comes to the pelvis, you're very rigid. When I try and spring the pelvis posteriorly, there's no give. And that's on both sides. When I try and glide your pelvis over from one side to the other, there's no give. Can I have you lie on your stomach now? And don't know if the camera will see that or not, but his sacrum appears posterior in relationship to his PSISs. And when I try and create some spring mobility, the pelvis continues to be very, very rigid. There's no spring, there's no give. And that's in every direction that I test. And that typically occurs from a fall onto the pelvis and the upper body weight, such as when someone pulls a chair out from under you, which is very similar to what happened to you. And when you fall on your buttocks, the upper body weight goes through the sacroiliac joint. The SI joint gaps and sacrum moves posteriorly in wedges, and that's the best explanation that we have for this phenomenon. You have ligaments here in the buttock called the sacrotuberous ligament, and those ligaments are very, very tight. They feel like bone, okay? And so if we're able to restore mobility in the pelvis, then those ligaments should soften and that mobility should improve. And I'm testing your coccyx for positioning and it is positioned to the left.
Okay.
So you've had that side bending pattern for quite some time. Your hip extension is good. Earlier I tested your hip flexion and rotation. When the hip is in flexion, there's a greater degree of rotation. We didn't provoke any pain with hip mobility testing. And I want to demonstrate the spring test on your thoracic spine. So I can induce mobility through your body in the T-spine, and I can do the same thing through the ribs. And I tested you on your back, and your upper sternum was not moving. And as I approach T3, T4 area right here, you're not moving. And this is a typical compensation for that sacrum pattern, is that the T3, T4 segment hyperextends reflexively, and the rib that joins that as well becomes rigid, and that's very rigid compared to the ribs below that and the thoracic vertebrae below that. Let's have you lie on your back and I'll film your head and neck. This truly is a whole body pattern. Basically, when the sacrum moves backwards, it's such an unphysiological pattern.
Okay.
It's just not designed to do that. And that shifts the center of gravity posteriorly. So it's almost like you would do well walking backwards, but you struggle to walk forward.
Right.
That's
how I feel.
Okay. And so the body then reflexively tries to get you upright, and you hyperextend right above the L5-S1 region.
Okay.
And the same thing at T3-4, but you also hyperextend up here in the suboccipital region at C1 and C2. Now when I try and traction your head, it's like a block of granite. I should get movement all the way through your body and see your feet move as well, but that's just not the case, not with 30 pounds of force. It's just very, very rigid. And when I try and lift your head up towards the ceiling, your head is very heavy. But if I bypass the upper cervical, the occiput C1, if I come over to C2-3, then I can lift your head up very freely. Okay?
Mm-hmm.
So this truly is a whole body pattern. And when we unlock mobility in the sacrum, then typically spring tests are then very free throughout the pelvis, and the upper body reflexively releases. So then the upper cervical becomes very, very free. So what's driving the bus is the sacrum.
Oh, yeah.
Yeah, and of course we would need to treat the coccyx as well.
Okay.
And I'll treat the hip rotator separately, and I'll treat the subtalar joint, the joint below the ankles, separately as well.
Okay.
But it's interesting because what I see in your body really fits with your description of what's going on in your body.
Okay.
And it's been about 20 years that you've been seeking care?
Yes.
Very good. Well, we will
20 long years.
Yes, indeed. Yeah. Alrighty. Well, I'll stop filming and we'll film the response to treatment.
Okay.
Thanks very much.
Thank you.